When it comes to health care as a key priority in this Ontario election, that can mean a whole host of things. The issues range from a backlog in health care procedures to more mental health resources and better home and long-term care. Now, the Ontario Medical Association is actually grading each of the party platforms and has come up with its own prescription.
We did ask people in Ontario, what is the most important? Now that we've come through 2+ years of COVID, what gaps in the healthcare system are you experiencing?
The result is a report card from the OMA called The Prescription for Ontario. 5 pillars have been set out and each are ranked with stethoscopes based on plans to reduce wait times, expand mental health services, improve long-term care, strengthen pandemic preparedness, and giving people digital access to a team of healthcare providers.
The parties are coming in at anywhere from 7 to 10 out of 18 overall. And so we really do believe that each pillar is important. This needs to be an integrated approach.
As part of the 2022 budget, the Ford government announced billions of dollars for hospital infrastructure over a decade and a new tax credit for seniors' home care. The NDP kicked off its campaign with a promise for universal pharmacare and funding to hire nurses.
Hiring thousands of healthcare workers to shore up our hospitals and other parts of our healthcare system. That's part of our plan.
More money for mental health services was also highlighted by the Liberals this week.
Ontario Liberal government would invest $3 billion in new money over 4 years to support mental health care here in Scarborough and right across Ontario.
An analysis done last year showed that there was a backlog of 22 million healthcare services in Ontario, leading to thousands of undiagnosed illnesses. Different types of surgeries have been delayed by months, even years.
This is too much suffering, too much waiting, and people have spoken. These are our priorities.
An Ipsos survey conducted for the OMA in late April did in fact confirm that healthcare is a top priority in this Ontario election. More specifically, wait times and the backlogs as a result of the pandemic were at the top of that list. For City News, I'm Mark McAllister.